Welcome to the Virginia Hospital and Healthcare Association's Patients Come First podcast series. Podcast episodes are available on VHHA.com and on popular podcast hosting apps including Apple Podcast, Amazon, Spotify, and many others. We're a member of the Public Health Podcast Network, Virginia Audio Collective, and the World Podcast Network. Podcast episodes also air Sundays at noon on 100.5 FM, 92.7 FM, and 8:20 AM across Central Virginia, 1650 AM in Hampton Roads, 105.1 FM and 1050 AM in Lynchburg, and Wednesdays at 1 PM on 93.9 FM in Richmond. Please send questions, comments, feedback, or guest suggestions to pcfpodcast@vhha.com. That's pcfpodcast@vhha.com. Today, we're pleased to be joined by Bernie Ammons, a nurse and the clinical program coordinator for vascular surgery at UVA Health, for a conversation about her work, the importance of heart and vascular screenings, and more. With that, welcome to the show, Bernie. Thanks for being with us.
Thanks for having me, Selena.
We like to start our conversations by getting to know our guest a bit better. As we noted, you are an experienced nurse with undergraduate and graduate degrees in your field. You currently serve as clinical program coordinator for vascular surgery at UVA Health. Prior to that, you worked in hospitals in Virginia and Washington State in various nursing roles including preceptor, ICU bereavement coordinator, labor and delivery, and neonatal ICU, among others. I'm sure those details are just one part of your unique personal story. So what else should listeners know about you?
Part of why I was able to have such a wide variety of experiences in nursing is I started my career in Richmond, Virginia at Virginia Commonwealth University at their School of Nursing, and working in academia allowed me the opportunity to try many different clinical areas, including critical care, radiology. I worked with cardiovascular patients for many years, but due to family needs and military support, I went out to Washington State for the last 10 years to support my husband in Army chaplaincy, and nursing provided me a way to be able to serve where the needs were and where the opportunities were. I'm a lifelong learner, and so when I would get into a certain field, I would make sure that I would do what I needed to do to become certified in those areas. But I have since come back home to Virginia to be near my family after military retirement, and have had the opportunity to start a career at the University of Virginia, working as their vascular surgery clinical program coordinator, which really encompasses looking at patients that have aortic disease and peripheral vascular disease.
Wonderful. Thank you so much for sharing that with us. We invited Bernie to be a guest on our show after seeing an article where she raised awareness about the critical role of heart and vascular screenings, particularly for those at risk. For the benefit of our listeners, I'm wondering if you can share an overview of vascular disease and heart disease, both of which are cardiovascular conditions, which are deemed the leading cause of death globally, and the distinctions between them.
Right. So cardiovascular disease, when the public normally hears about that, they think about heart attacks or things that can lead to stroke, but it really specifies looking at the heart itself. But, we have arteries and blood vessels throughout the rest of our body. And so the same things that can contribute to heart disease also contribute to the disease of our blood vessels and our arteries that, affect our limbs. So they work hand in hand, but they are different disease processes. So when I first got here to UVA, one of the things that I noticed was there was some lack of knowledge in terms of the public knowing what, for example, peripheral vascular disease is. And a lot of times in the public, we hear information about stroke and heart attack, which is very, very important. But there's also some other underlying diseases that can be screened for, like aortic diseases and peripheral vascular disease. So screening for those is also very important.
And from what I gather, people with vascular disease may not even be aware they have the condition due to a lack of symptoms. Early detection and treatment of vascular disease can significantly reduce risks for serious conditions like a heart attack or stroke. Can you share with us some key risk factors for vascular disease?
That's definitely correct. So basically, here are some people that might benefit from getting vascular screenings or abdominal aortic screenings, and those would be men and women aged 40 to 75 who currently or previously have a history of smoking. Men in particular, age 65 to 75 years old, who have never smoked could also benefit from being screened. And it's very important to know your family history of peripheral vascular disease or aortic disease. Other risk factors are hypertension, diabetes, high stress levels, an inactive lifestyle. History of smoking is a really large one, and high cholesterol and being obese.
So screenings are intended for individuals who are not experiencing any symptoms of vascular disease. For people listening, what are the current clinical recommendations regarding candidates for vascular screening, and what does that process entail?
Well, when you want to get screened for vascular screenings, there is, for example, at UVA, we have a community vascular screening. For a nominal fee, you can get the blood vessels and arteries scanned with an ultrasound machine, those blood vessels that feed the head called the carotids. The screening also can test for an ultrasound that's done over the abdomen to check to see if that big aorta, which is the main artery that feeds the lower body, if that has any risk factors for, being enlarged or having plaque or buildup of what people might think of as cholesterol. It also will screen and do blood pressures of your upper arms and your lower legs to see if you have decreased blood flow to your feet or your arms. So those screenings aren't typically covered by insurance, but if you have all those other risk factors that I described earlier, it might be worth talking to your primary care provider to see if that would be a beneficial screening. Now, when we talk about an abdominal aortic aneurysm screening, I think a lot of people aren't aware that if you are 65 years of age or older and you have smoked in the past, or if you have a family history of aneurysms or aortic disease, Medicare Part B will cover a one-time, once-in-a-lifetime screening for free, or it is covered by Medicare Part B. So those are things I think the public aren't really aware of, and it's something you can talk to your primary care doctor about to get screened. And there is a number also if people are interested in getting any more information about where to get screened for aortic disease, or if they have a provider or a primary care doctor that would like to get more information, they can call 1-833-UV-AORTA.
Thank you so much. And earlier, you shared insights on heart disease and vascular disease. What general advice would you offer to listeners to protect and promote heart and vascular health?
Well, I would say it's really important to know your family history. Many people don't know or have heard maybe that they had a family member that died very suddenly, and it could be related to a heart attack or sudden death, but it could also be related to family disorder of the aorta, and many people can get tested. There's genetic testing available for that, but the biggest things also correspond to what can prevent heart disease, which is smoking, and trying to stop smoking is critical. Keeping your blood pressure well controlled, having physical activity with walking if possible, staying active, and also watching your diet and your weight and having a good, healthy weight. Those are key things.
Thank you so much for being with us today. Before we let you go, we have a tradition to close things out by asking guests a pair of surprise questions. To keep things interesting, we have a list of 10 mystery questions. So please choose two numbers between 1 and 10, and I'll ask you the corresponding question.
Okay, I'll choose number 4.
Number 4, which, if any, of the following things do you consider most plausible? Bigfoot, Loch Ness Monster, or UFOs and aliens? If none of those apply but you believe in something else along those lines, please share it.
Well, some people might say that Sasquatch really exists. Being from Washington State, we used to see and hear a lot about that. I don't know how true it is, but maybe it is. You never know.
That's a great answer. And do you want to pick one more number?
We'll go with lucky number 7.
7. If you could choose one superpower to have or any one skill to instantly master, what would it be and why?
Superpower. If I could continue to spread peace and show people how to continue that in their communities, that's probably would be a great superpower.
That is such a beautiful answer. Thank you so much. And that will bring us to the close of another episode of the Virginia Hospital and Healthcare Association's Patients Come First podcast. If you like what you heard, please make sure to leave us a 5-star review on Apple Podcasts and subscribe so you know when new episodes are released. And we want to once again thank our guest, Bernie Ammons, for joining us today. So thank you.
Thanks for having me, Selena. It was a pleasure talking with you.